Hey, John, we can hear you. Not anymore. Thank you.
You're welcome.
Is that you, Tia?
I'm well. How are you?
I'm well as well. So
That's
thank
good.
you for organizing this. I appreciate it.
Oh, no problem. Just another day for me.
Oh, I know. Long ones, I'm sure.
Yeah. Yep.
They probably don't get any easier. Hello, Janet. This is Rich. How are you?
Good, Rich. How you doing?
I'm well. Doing okay?
Yeah, pretty good. My grandson went back to school. I'm so excited.
He must be too.
Oh my goodness, you wouldn't believe. I think he'll love school for life now.
That's good. Excellent. How old is he?
7,
Oh, a good age.
first grade.
Good age. Hello, Ruthie.
Hey, how are you?
I'm good. How you doing?
I'm doing well. Hi, everybody. Oh, there's Mr. T coming on.
Yeah, the senator.
Yep. And hi, Janet.
Hi, how you doing, Ruthie?
Hi, everybody.
Hi,
Janet,
Ben.
I'm going to be in touch with you. I'm going to be able to be, if it's okay with you, be on your elder committee.
Oh my goodness, that's so great. Oh, I'm so excited.
Yeah, so that should be good.
Oh, nice.
You're not old enough.
Yeah, right.
None of us are old enough, right?
Nah, just young at heart.
Oh, how exciting.
Hey, Rich, I'm glad to see you have pants on today. You get up and close the window.
Yeah, they're the same ones I've been wearing all for the last year and a half.
Hi, Ben.
Morning, how are you, John?
Hello, Ben.
I'm living the dream here. Living the dream.
I'm sitting in for Tiffany Davidson Parker today. She wasn't able to make the meeting.
Oh,
Providence Center.
well, that's good. At least we picked a good person to sit in.
Thank you.
And there's Lori Marie.
Morning.
Morning, Lori.
Good morning,
Good morning,
Lori.
everyone.
Hi, Larry.
Good
Hi.
morning.
Right. It's a slow morning for everybody here. Jeez.
Yeah.
Usually we have like, 30 or 40 people by now.
I don't want to say nothing, Rich, but I think Nick could be the person running the meeting.
Yeah, I know.
No, no.
Yep, that's a definite possibility. Well, I think if I run 3 more meetings, I'm vested in my state pension, so.
Oh, don't, you shouldn't say that. You should, that's it. They're gonna tell you next month, that's it. We don't need you anymore. They bring you right up to the
That's
podium and
right.
say, okay, you're gone.
See ya. Mhm.
Well, I was working on the low number license plate, but that didn't work, so I'll go for the state pension.
Yeah, there you go.
Yeah, someone looked at my license plate and said, clearly, you know no one.
What do you need, Ruthie? What do you need?
Okay, well, we'll have to talk,
All
Mr.
right.
Okay, well, people are coming on now. They got their coffee. Hello, Linda.
I just put it on Facebook, Rich. You're all set.
Thanks. It's Corinna, Stephanie, and Chris Gadwa.
Steph, you all moved in?
Not yet. Oh, I'm so close. I'm so close, John. It's like every time I move a box, I feel like more stuff appears. Why do I have so much stuff? We're getting there though. I have new floors are going in on the new house on Monday. And by the end of next week, I will be all completely moved in, even if I just have to leave stuff in the dumpster and say, I don't need it.
Now, you sold your house, right?
Well, I was renting here.
Oh,
and-
okay.
And I bought a house, so.
Great,
This
great.
house will be, I think the owner is renting it because they have 100 people who are interested in seeing it, and they have 30 showings just between Saturday and Sunday.
Wow.
Yeah,
Wow.
so it's a great house. It's a great it's a 4-bedroom house. It's got a great yard. It's in a nice neighborhood, so it'll go quickly. He'll have no
Wow.
problem renting it so I can get my deposit back.
Oh, congratulations to you.
Thank you so much. I'm really excited.
So I think we're all here. Anybody from DCYF here or DOH? I'm looking at the screens. All right. Well, as all of you know, probably, my name is Rich Leclerc, and my emeritus chair status has come up and asked me to now chair this meeting, and in the absence of a permanent chair, so I'd be glad to do that. I know many of you. I miss seeing a lot of you in person, and maybe we're getting close to that day. Who knows, right? So I'm quickly looking to see. We are okay. Now I got to monitor the chat room. This may be impossible, but we'll figure it out. Okay, great. Well, let's call the meeting of the Governor's Council on Behavioral Health in order here, and we have a quorum. Now that Ian Knowles is here, we definitely have a quorum. Okay, so we don't have any presentations this morning unless there's any last minute slideshow about summer vacation for anybody or recent family gathering. We'll just move right on to the various committee updates. So Laurie, you are on first with the Olmsted Committee report. So let me turn it over to you.
Oh my goodness. Thank you so much, Rich. Good morning, everyone. It's really great to see everyone. So the Olmsted Committee remains an action-oriented, motivated, energetic committee. We are getting stuff done. So we've received an official endorsement for our proposal to establish an Olmsted plan from the Governor's Council on Disabilities and also from the Developmental Disabilities Council. We are still awaiting an official endorsement from this body today. There's still time to endorse us. But in the meantime, we have shared our proposal to establish an Olmsted plan with the Senate Committee on Oversight. It was well received. Senator DePalma expressed interest in this work, and we met with him privately. I heard from a representative that the General Assembly was considering establishing a caucus on disabilities, which would, I guess, look into the Olmsted issue and possibly, if it ever came about, might be part of overseeing it. But I have yet to hear anything further about that. So we are getting this information out into the community. People are starting to talk about Olmsted, and it's been really exciting. We met with the Attorney General's office recently. We are setting up a meeting with Secretary Jones. And so we remain in the position of collecting official endorsements for the proposal, and also developing some visual aids to explain the tougher concepts to community folks. That's where we're at right now. So we've been busy, we're having meetings, and we're spreading the word wherever we have an opportunity. And if any of you would like to see Rhode Island have an Olmsted plan for people with disabilities, I encourage you to reach out to us. I can give a little presentation to your group, to your organization, and I can answer any questions you may have. I have a really nice PowerPoint.
Great. Are there any questions of Lori? Lori, I heard in your report the suggestion, or maybe I think it was a motion, that the Governor's Council endorse the creation of an Olmsted Committee. Did I hear that correctly?
Thank you, Rich. So the issue came up when Director Power was leading these meetings, and at that time, the information that was shared with me was that there was a lot going on, and it wasn't the right time to really dive into it. So it was sort of put on the back burner. So we haven't addressed it here, but that's where things lay.
Okay.
Kind reminder to mute, please, if you're not speaking. Thanks, everybody.
Yep. Hold on. Thanks, Ryan. Yes, I understand. Well, we're not asking for BHDDH
Right.
endorsement, right? We're just going to ask for the Governor's Council endorsement of creating an Olmsted Committee. I think this has been on the agenda for a couple of years, right, Ruthie?
Absolutely.
So it's basically a committee to look at some of the elements of the plan, to put together a plan. So there's still tons of work that to be done. There's tons of work that's happened. And right now it's basically endorsing that concept so that either the Governor's office, the General Assembly, or someone else can move on it. This just makes the Governor's Council position a little firmer in being able to officially endorse moving forward on that. So I'll take that as a motion. Is there a second?
Second.
Okay, a bunch of seconds, including John. Thank you.
There was a second in the chat
discussion.
box too.
Megan, second in the chat box. We can have more than 1 second, but we got a second. Great. Any discussion on this?
I just want,
Yes, Ruth.
oh, I'm sorry. Go ahead, Ruth.
Ruthie, then Stephanie.
Yeah, I just want to remind everybody that this body endorsed this this concept previously. And again, it's not for this body to serve as a commission, but it's just to move forward the notion for and to endorse the concept. And so I just want to remind everybody, this isn't the first time. It's been, and as Rich knows, because he signed all the letters, it's been endorsed before.
Okay, so like a re-endorsement, but never hurts to re-endorse. Okay.
No, it does. But I just want to say, historically, it's been endorsed. So
Yeah. Okay, but sometimes, okay, Stephanie?
And I would just add, Rich, if you recall, I'm not a voting member currently, but maybe about 10 or 12 years ago when I was on the board and a voting member, this board used to quite often send letters of endorsement to the General Assembly and to the governor, because that's who we are charged with, giving counsel to on a variety of topics when it came to different legislation that had to do with mental health and things that were being put forth from BHDDH. So I'd like to see us getting back to that sort of role of endorsement. And I think this is a perfect place. Lori Marie's team every week has had some new, video or speech or something going on. And I think that's a great way to support her.
Thank you, Stephanie. Thank you, Ruthie. And thank you, Rich.
Okay. Any other discussion? Yeah, it's this is an advisory role, an advisory position, and we can go on record if there's an affirmative vote on this. I do understand that officially, Catherine is still the chair of the governors, so the governor has not appointed a new chair. So we are, treading on probably, some sensitive areas, but I don't see this as something controversial at this point. We're not speaking for the department. We're speaking for the Governor's Council. Okay. Anything else? Okay, I'll call for a vote. All those in favor? Yeah. All those in favor, raise your hand, shout, jump up and down, signify by saying aye. Okay.
Aye.
Okay. Any opposed? Let me look. No opposition. Any abstentions? Okay, so I'll declare it as unanimous endorsement by the Governor's Council on this position. So Laurie, thank you and your committee for the work you've done and the work that's still to be done as we try to move this forward in a more official position at the state level. Okay. And anything else, Laurie, on that before we move on to the prevention?
No, thank you, Rich. Really
Okay.
appreciate it. Thanks, everyone.
Thank you. All right, Sandra Del Sesto, Prevention Committee. Sandra, did I see you on there? Sarah, is there any update? Sometimes you.
No, we are meeting, the Prevention Advisory Committee is meeting on May 26th, and we have not met since the last Governor's Council meeting.
Okay. Okay, great. Thank you. And I just want to remind everybody to please sign in the chat box as you're present. Since that's the way we're going to keep track of who's in attendance. So many of you, if not all, have done that. Of course, I haven't done it, but I will. And so unless John can do it for me. Okay, great. Christine Gaboir, the RIEMHAC Committee. Chris.
Good morning, everybody. I'm not sure if Janet would prefer to give our update, but.
Okay, Janet, I know you're on.
Well, sure, I'll give an update. I have good news for everyone. I just announced to me today that Ruthie Fetter is joining our Elder Mental Health and Addiction Coalition. So we really don't have anything to update. So we haven't had any meetings since the last meeting, but I'm sure we'll have some update with Ruthie next meeting. And Chris does have some news if you want to share on behavioral health.
Oh, sure. Yeah. So the long-term care coordinating council, which I'm sure many of you are familiar with, has worked closely with the Elder Mental Health and Addiction Coalition over the past couple of years on issues around behavioral health care in the nursing homes and around the continuum of care and ability to care for patients with behavioral health issues in long-term care settings. And has
well, one second. I'm trying to turn off.
Could you put on mute, please? Okay, I'm sorry, Chris, go ahead.
Oh, that's okay. So the Long-Term Care Coordinating Council has decided to formally create a subcommittee work group on older adult behavioral health. So, and I'm the chair of it. So the good news is that, Janet and I are going to try to figure out how to make sure that efforts aren't duplicated and that we all continue to collaborate on these issues. And I guess just one more thought as we think about behavioral health care in the nursing homes. A number of folks on this call have been trying to come together to, there's always been a shortage and a problem. Rich, I know this, you have been addressing this issue way back at Gateway, how to get the psychiatry and counseling into the nursing homes. And the problem is now exacerbated as of this month with the loss of the larger behavioral health consultative provider in the nursing home. So we are working with stakeholders from the Elder Mental Health and Addiction Coalition is working with stakeholders to try to address that.
Okay, thank you. Thank you. Is there a meeting set up for the next meeting that people are invited to or need to know about, Janet or Chris of the Elders Committee?
So no, we will we'll reach out, and in the meantime, if folks are interested in any of these older adult issues, please do reach out to Janet and I, and we'll pull you in.
Yeah, we do have a listserv, and if anybody's not on our listserv, I'll put my email address on the email address on the chat, and they can ask to join our listserv.
Okay. Great. Thank you. Any questions from anybody? Okay, then let's move on to the department updates. We've got BHDDH, and Linda, I've got you listed as giving the report.
Yes, I think that's my role for today. So there's been a fair amount of activity going on related to some of the COVID-19 supplements and grant funding. So I think we reported out last time we met that we had submitted our supplements. We had followed the process of getting approval from our OMB, the state OMB, and we're awaiting SAMHSA approval. We received SAMHSA approval for the mental health block grant COVID-19 supplement. We continue to await the final approval of our substance use block grant COVID supplement. We understand that that's now at senior leadership at SAMHSA, so we're hoping to hear any day now. Some of the activities that are related specifically to the COVID-19 supplement for the mental health block grant had included sort of the expansion of our crisis response continuum. There has been a process where we solicited information through a request for information about potential models for us to explore and delve into deeper. A working group internally had reviewed them, was reaching out to other community stakeholders for information and doing some general research on the implementation of those models. We're really looking at trying to map what's going on throughout the state in terms of things that BHDDH funds, other sister agencies may be funding, and any other funding streams that may be supporting the crisis continuum. We are ultimately looking to do an RFP for a pilot site for Cahoots. One of the challenges that we're rubbing up against right now is as we create an RFP, our State Division of Purchases regulations sort of preclude any discussion of the contents of the RFP. And a working group here at BHDDH is attempting to see if we can find a way to do more community and stakeholder engagement in that process. And we're working with the Division of Purchases and our liaison to find out if there are ways and vehicles of continuing to do engagement while the RFP is pending. And, really trying to honor the nothing about us without us principles of working together and stakeholder engagement. Again, it's difficult when we have purchasing regulations that really constrict and limit the ability to talk about components of an RFP. So we're working on trying to figure out a way to continue that engagement. Other important information is that we are going into the second round of funding for our regional prevention task forces. We did a competitive RFP in 2016 to start that process rolling, which moved what had been 35 municipal prevention task forces into a set of 7 regional task forces. We subsequently got delegated authority, so it's a bid process that's managed internally by BHDDH, and those proposals, I believe, are due Friday. So we're looking forward to continuing the excellent work that the regional prevention task forces are doing. Also yesterday, a team from BHDDH, Brenda Clement, Director of Housing Works Rhode Island, and Laura Jaworski, Executive Director of the House of Hope, Michelle Brophy, Corinna Roy, and myself did a presentation for the Governor's Overdose Task Force on the housing continuum and behavioral health services, and looked at a wide range of the residential programs we offer through BHDDH, in also recovery housing, which we fund with grant dollars. And our community partners talked a lot about the services they provide. And Michelle gave us an overview of the housing continuum. So we continue to be busy here, trying to get services to folks. So if there's any questions, I'd be happy to take them.
Okay, thank you very much, Linda. Any questions from anyone in attendance here? Yes, Janet?
Yeah, Linda, I know this is not your area, but there's so much discussion on Eleanor Slater eliminating their psych units. I don't know if there's any way it could be part of your update, if there's any update, or if there's somebody else we should ask for that, or how we could get informed.
It wasn't something that I was prepared to update today, but Ryan, I think being on the call with us, can forward the request for that information.
Thank you.
Okay. Is this something you want to tackle, Ryan? Or is this?
I can give a brief update if it's helpful, just to say that Governor McKee has asked for any major transitions in the hospital to be placed on pause at the moment. And this is a public statement as of a couple of weeks ago that some of you may have seen, that pending any further decisions to restructure or change Eleanor Slater Hospital's footprint, he would like to engage in more robust community stakeholder dialogue, and also a little bit more discussion with organized labor, particularly both campuses, and also in view of what the system's needs actually are if Eleanor Slater's footprint were to change. So there are right now, I think just the big takeaway there is that items are paused.
Okay, thank you. Other questions?
Yeah, I appreciate that so much, Ryan, that update. And I just like to offer that we may take part, or offer to take part in that community stakeholder engagement process. So if there's any way we want to meet on how we might be able to do it, or what the thoughts are, or whatever, we'd be happy to try to support that.
Okay, thank you, Jenna.
Rich, I just have a question for Linda. Linda, on the RFP for the Cahoots program, is there a timeline for when we'll be seeing that RFP and for when implementation is hoping to take place? Because I did read in the block grant information, I know that's a really big part of the block grant. It's really exciting. So what's the timeline looking like? Is there any idea?
I think we're looking to post fairly soon, and then there's we have the ability to contact all interested vendors. So we'll make sure all the members of the Governor's Council are contacted when the RFP is available for release. And as I mentioned earlier, we're looking at potential ways to continue that engagement during that process, but not to run afoul of the purchasing regulations, because we wouldn't want anyone to be disadvantaged and be unable to apply if they were, interested applicants. So I don't know if, I know Corinna's been part of that process. Corinna, I don't know if you wanted to add anything more about a timeline. Some of it, I think, is really contingent upon how long it takes for the Division of Purchases to post.
Yeah, I mean, I think that there's an internal review process which will have to happen as well, that sometimes takes a little bit of time. We've had internal reviewers make some comments. I think we need to meet to discuss some of the issues because there is a pure model, if you will, that's the Cahoots that was done in Oregon, but there's been a lot of other models that have been developed that are some version of this. And, so we're just hearing a little bit more about sort of best practices that we can find. And then today I'm actually, and our fiscal department is meeting with purchasing to discuss the potential for vetting. And then as soon as that's done, I think we can move forward. So hopefully in the next couple of weeks, we'll at least get it through, or at least to the internal review process that goes, I think, all the way to the secretary. So
Thank you both so much.
On the chat, there's a question about whether there's a statewide needs assessment. Is that being considered? And my impression is there is a block grant needs assessment that's being updated this current year. It will be done every 2 years. But Linda, can you or Ryan or someone else from BHED speak to that in terms of the timeline or the scope of that? And I think URI is doing it, or
yeah,
maybe-
and I'm not sure if that actually came in reference to the update about Eleanor Slater, but yes, there is a block grant needs assessment. It's been underway. I think we're in the final stages of it. So that process
Linda?
happens annually.
Linda, I can speak to it briefly. It's wrapping up and it will be presented at the next Governor's Council in June.
Whoa. Okay. We'll have to add extra seats. Okay, thank you. Chris?
Thanks, Rich. So one more question about the Eleanor Slater situation. What's the role of the Governor's Council in helping with some of that stakeholder engagement that the governor is looking for? It seems like this body would be sort of perfectly positioned in terms of having broad representation to be able to advise or review or whatever it is, whatever sort of input the governor is looking for, seeing as this is his commission. So at a minimum, is it going to be on our agenda? Is there going to be a work group? So kind of just process.
Yeah, I think at this point, we don't know a lot about this, except that there's a pause on it, as Ryan said. So I don't think I think there's going to be public feedback. I don't think this is going to get dragged out over 2 to 4 years either. So it's going to happen in a fairly tight time frame. I think we can at least make sure the governor's office knows that this body exists, and one of our functions can be to serve as a sounding board or get our opinions on the direction we want it to go, as well as many other groups in the state. So we don't have that exclusivity. So we can make that known to the governor's office. So at the right time, I mean, I still think the administration is making sure that this COVID thing is well underway, and that takes a fair amount of oxygen out of the room. So with the Eleanor Slater stuff on pause for now, at least on some of the major scope changes and stuff, I'm sure there's work going on that I think we're that'll be maybe one of the next things to tackle, especially if the General Assembly adjourns anytime soon, and then takes other things up in the fall. I heard they may be coming back for some other issues, especially some direction on where all this money is going to go to in the state of Rhode Island. So I think they'll have a say on that. So we may have there are a lot of things keeping this administration busy, and this is just one of those things that are at the top that I'm sure will get launched pretty soon when they have the time to pay attention to it. So we'll make sure that at least we get approached on that. And if it's it's up to the governor's office and the governor. So if they choose to go a different direction, then so be it. But at least we can make it known that we're ready and able and willing. So thank you. Good question. Any other?
Rich, I have a question.
Yes, John.
Maybe it'd be a good idea for the council to invite the governor to the next meeting.
Sure, we can invite. I'll talk to Ryan about that offline, or whoever we can, to see how we can make that invitation.
Rich, I have a question.
Yes, Sandra.
There was a reorganization going on, I thought, at the department. And since Catherine has left, I'm just wondering if that's continuing or if that's just being held at bay for now.
I don't have any information on
Well,
that.
would
I don't-
Ryan, Corinna, or Linda have anything to offer?
Sandra, we don't have a comment about that at this time. Thank you.
Oh, okay.
yeah, there are probably a lot of discussions, but very fluid, no decisions made, ideas and things. And so and Secretary Jones, I think, is, running it. So I'm sure that's not going to be on the long term, but.
Yeah. Okay, thank you.
Good question. I don't want to miss anybody. Go ahead. Who has a question?
Lisa.
Hey, Lisa, go ahead. Oh, yeah, you got your hand up.
Yeah,
Thank you.
I've had my hand up, sorry. I'm trying to use technology.
Yes, I was going to recommend that and I missed you.
So I had a question actually for Linda, going back to her report, because it just reminded me of how many, there are a number of areas in the continuum of care that are strictly supported by grant funding. And that really has been one of the inhibiting factors for our state to be able to move forward. So I'm wondering, as we move forward into planning for infrastructure reinforcement through the American Rescue Plan Act funds that are coming into the state, have you mapped out, not you personally, you, the organization, EOHHS, mapped out what components of the continuum of care are currently being supported by grant funding that could otherwise have permanent investment made into them that would be able to move forward and be stronger as we move forward? Sorry about my dog there.
Okay.
So we have been engaged in extensive planning with OHHS. Marty's been a great partner in that process and thinking about how we might use the American Rescue Plan funds to address some of those systemic gaps. I think that's an ongoing process that we can provide updates on as that becomes a little bit more solidified. I think at this point we're still waiting for notification of awards to help us with implementing some of those strategies. I don't know if Ryan or Marty would like to add more to that.
So EOHHS and the agencies did write up, as folks probably know, we were asked to write up proposals around the American Rescue Plan. And wrote some very significant ones around behavioral health, across the lifespan. And we do not have any more information than anybody else does about the process. The legislature is involved in the process, obviously the governor's office and OMB, and the Rhode Island Foundation is having, their work to include a public process. And, I've just been saying, get involved, talk to everybody. Everybody should talk to everybody that they can about the priorities. There are obviously a lot of folks putting out priorities for those dollars. And, the state departments have laid out a possible path for what opportunities can be based on all of the discussions that we've had with all of you for years. And, folks need to add to those voices, calling on the folks who will be making the decisions to include the crucial behavioral health needs that are out there. The departments are not making the decisions. We provided information, you've provided information, you should continue to do that.
So I wasn't actually referring to that piece, because I do think that comes later, and I understand that we are not the decision makers. What I'm more curious to know is whether or not we have mapped out the places within the continuum of care that are currently being funded through grants, because it's my feeling that in some ways, when we're already funding something, we believe that it's secure within the continuum, and in fact, it's not, because it's always at risk, because it's funded through grant funding. And so my question is really directed at those services within the continuum of care that are currently being funded through grant opportunities, whether it's braided funding or otherwise, so that they are also, so that's taken into consideration as we move forward with the other decisions that will follow when that money comes. So it's really, my question is about the programs that are being funded by grant funding of any kind, not just the community block grant, that are supporting our continuum of care and actually creating the fragility that we have with it.
So I can speak a little bit to BHDDH's process for that. There were some particular areas of gap that we identified and noticed around transition age youth, for example, in terms of needs. And so those were well mapped and included in our requests for the American Rescue Plan. And other levels of care where we know we're underbedded, particularly with substance use disorder, in terms of seeking startup funds to increase access. Housing, obviously, always an issue. So these were things that we did take time and effort to think about, map, and include it in the requests that we made with the American Rescue Plan. So that mapping process has been utilized and has resulted in us taking steps to try to secure more permanent funding streams. As we understand it, the American Rescue Plan may have a lengthier time frame or the next set of awards, but it's not in perpetuity. Some of that would require other types of support and assistance beyond the American Rescue Plan. I don't know, Lisa, if that was responsive to your question.
Thanks, Linda.
So Linda, just to follow up on that a bit. So the department at least can map out those grants it provides through block grant to the various providers. But there is no way that we capture how, if providers themselves are going after grants and it's helping support the infrastructure of their organization or their community, that doesn't get recorded anywhere, nor maybe, or how's that, if it is it recorded anywhere, and is that taken into account when the department looks at additional funding such as the ARP?
Right, I mean, I think we're fairly knowledgeable about the grant funding that the provider network, at least the licensed provider network we support, receives. And that factors into our considerations about sustainability. It's, great if folks get, there's a handful of CCDHC grants, but if that's a system that we want to scale up and have statewide, that would be something we need to factor in and consider. Is there enough of a critical mass to move that forward? So to Lisa's question, we are aware externally of what our provider network is seeking and receiving in terms of federal grant funding. We don't, in several cases, we don't necessarily have a specific approval or notification process that's required for us, but we certainly support those efforts.
Sure.
I'll just say it's something that does factor pretty heavily into our planning. We do look at sustainability for what grants can go and how they can be, how the services funded underneath them can continue. One thing I will say about the ARPA funding is that it is intended somewhat to be short-term. It is intended a little bit to be a bit of a stimulus in its own right, in particular, not a stimulus in the sense of the economic crisis, the more in the sense that we're all anticipating a pretty significant behavioral health system effect associated with COVID-19 and the after effects of it. And this is one source of funding the federal government is making available to try and address that over a relatively short period of time. But I'll just echo Linda's points on sustainability and what the conversations we try to broker to ensure that there are there's both better coordination among grants that come to Rhode Island and ensuring that they are additive to each other rather than duplicative and rather than than isolated, and also that we do the best we can to take the perspective of sustainability and how we can sustain the interventions that grants initiate.
Okay, thank you. Helpful, Ryan. Other questions of Linda or regarding BHDDHI matters? Thanks. So next time, I guess we will get the update on the needs assessment, and there may be more questions about capacity and support, as we look at that. So great, thanks. Next, Jeff Hill from the Department of Health. Jeff, I know you're on the line here somewhere. Any report from you?
Hi, good morning. Yeah, I'll try and be quick. I think we've been very fortunate for some very quick turnarounds from SAMHSA, 24 to 48 hour turnarounds on carry forward requests. So they're really doing their best over there. I'm pretty impressed. So with those turnarounds, we've actually been able to increase some mental health first aid training for our first responders and for EMS through grants that we have at RIDO. So those are continuing and will be continuing through September for EMS providers across the state for mental health first aid. And as well as some carry forward funding that we're using this fall. The announcement should come out fairly soon. This fall's Bradley Conference will be dedicated specifically to suicide prevention and training and screening tools for community members and also for clinicians. So there'll be specific trainings for clinicians and things, and these are all going to be provided at no cost. So we're taking care of that piece. So we'll be excited for the Bradley Conference trainings that'll happen this fall on that. And then on a separate note, Director Yarn and I lead the Governor's Challenge, which is a VA SAMHSA initiative to prevent suicide among service members, veterans, and families. And I will make note, I'm going to put it in. There's a listening session that's going to be happening at the end of this month on the Sergeant Parker Gordon Fox grants that the VA will be putting out to the community for suicide prevention. So rather than, this is a different set, rather than it coming from SAMHSA or from some other HHS agency, this will be coming from the VA side for prevention. So there are listening sessions that are going to be happening at the end of this month. And so I thought I would put that information out there for those that are interested.
Okay, thank you. Questions of Jeff? Okay, hearing none. Thank you, Jeff. Appreciate it. Good information. Next, we have OHHS. Chantel, are you on the line or someone that can make the report? Or is that you, Marty?
Yep, absolutely.
Okay.
So a couple of things. Some of you, I know, were just on a call where we talked about the Children's Behavioral Health System of Care, and we have been very active on the system of care work. We had our first public meeting in April that I think a lot of you were at as well, and we've started 7 public-private work groups. I have the deck that I just used to talk about this, so I thought I would just share. And these are the public-private work groups that we invite you to be a part of. The Crisis Continuum, which is talking about, you know, how we plan for assessment, screening, and engagement of families into the children's system of care. Care authorization and care coordination. We're starting actually with a focus on care coordination, and this is sort of getting into who's the quarterback for families who need services. Looking then at the whole service array, this includes prevention. Folks have been really talking about the need to include primary prevention. We're hearing you, we're going to talk about that, and ensuring that the service array is adequate. The fourth work group is around ensuring equity. We do everything, of course, with a race equity lens. And so this work group is going to be working with the other work groups, because we don't ever want to have our equity conversations in one place. We want to make sure this team will help all of the others in their planning have a race equity lens. Looking at workforce transformation, the variety of things that the workforce needs, including training and education, et cetera, et cetera. Data systems for outcome measurement and evaluation. In particular, we have, we're obviously looking at how we're going to be able to set up metrics so that we can make sure that what we're doing works. And then specifically, we have applied for a SAMHSA grant for this work, and this group will be helping set up the evaluation for that grant. But not, as we're thinking about it, we want to make sure that we're looking at it across the board. And then community outreach and education. There are 2 components to this work. One is making sure that folks in the community are engaged in the planning. So how are we talking about the work that we're doing now in our planning, but then also how do we make sure that families know about the various components of the children's behavioral health system of care. So a lot of work going on, and we encourage folks to get involved. We had put out a an invite and a place to sign up to be a part of these work groups. And I think just to make it clear who's signing up when, I think we're going to probably release another one, and I'll make sure that Ryan and the BHDDH team and Tia have it to send out to everybody so that if you want to get involved, you can. The first round of these meetings started last week. And we're on essentially a 4-month sprint with the first round of these meetings. They're going to be, setting up the initial planning components. And by the end of that 4 months, we will know about the SAMHSA grant. We'll hope that we got the grant and we're going to be able to be implementing that. And then we will move forward with the next set of steps. So we expect those work groups to happen for much longer than 4 months, but we're having a sort of a 4-month planning component, and then we'll figure out what more the work groups will be doing for implementation. So it's exciting and daunting, and we understand all of the challenges with the system, and we really are committed to, in an interagency way, addressing those. So that is the children's work. The BH system review, I know that the Faulkner team came here, I believe it was in March, to present the interim report. I want to give you an update on what we're doing now. We're going to be releasing the full interim report within 2 or 3 weeks or so, just last sign-offs and such. We're going to be looking for public comment on that in 2 ways. We're going to have an opportunity for written public comment, and then I'm like 90% sure that we're going to be having one public meeting where folks can add on. The Faulkner folks interviewed a whole lot of folks for that system review, and even before they got to the interviews, they looked and got every piece of written testimony and reports from folks in this meeting and in other meetings. We met with the Leadership Council, but there are still some folks who have noted to us that they were not engaged in that. And so we want to make sure that in the look at the report, that anybody who felt that they were not included has the chance to be included before it's done. So that is the purpose of that 2-part public review, written and a meeting. So we'll make sure that everybody knows about it and invites this group so that you can be a part of it. Part of that work is thinking about the CCBHC, and so we've been talking with folks about that. You'll have the opportunity to comment on the thoughts about implementing CCBHC. Also, the community referral, the community referral platform, the e-referral platform. Folks know probably that had been in procurement. It is so close to being done. It is at purchasing, awaiting a purchase order. I cannot talk about it until, we can't announce it until the purchase order is put forth. But the community referral platform is a key piece of the way to ensure social determinants of health engagement with physical health providers. So the idea is that physical health providers will be able to use this referral platform to help connect their patients to social determinants of health. And we know that KidsLink has been using this. There are a number of different platforms and ways that this has been being used in the community. Once we are able to say which vendor we have, we'll then be talking about aligning that work. We know there are questions about how it's to be used. And I will also say that we have just set up a health information technology steering committee. That group is going to be engaged sort of in helping with the alignment, but of course, we'll be talking about this with all of the physical health folks and the behavioral health providers and the social determinants. So that will be the beginning of that implementation will be happening, starting in, I'm just crossing my fingers, in about a week. Just another quick note. Folks probably know that the 988, well, I hope that you know about the existence of 988. which is a congressionally created line for suicide prevention and behavioral health crisis. And the planning is happening for that. We have to have a plan by next summer of 22. And just to let you know that as we are talking about the mobile crisis within the children's system and the mobile crisis within the CCBHC world, we're talking about that with the 988 planning. And the idea is not to have 3 different mobile crisis systems, but to make sure, and BH Link is involved, and we need to make sure that we have a rationalized system. There are different needs that of services and clinical supports that families and kids and families and adults and seniors, everybody needs, but we should be talking about it, in one systematic way. So that is happening, and it's a critical way to tie that planning together. And then the overdose task force. Linda mentioned it, that there was a great presentation on housing yesterday. We continue with the overdose task force to implement the evidence update that EOHHS helped carry out last winter into the spring. And then we're implementing that. There were about 26 recommendations. Let me raise one today that we're focused on and pretty excited about. The Racial Equity Working Group is working on the recommendation to do a racial equity strategic plan, similar to how we're thinking about the engagement in the children's behavioral health. It's not up to the Racial Equity Working Group to focus on racial equity for our work on addiction. It's up, that group is going to help all of the other work groups that are part of the overdose task force have racial equity plans and measurable objectives that they need to focus on in their work. So we're looking at getting some funding for the racial equity work group and allowing them to do that, to drive that strategic plan. Let me go to the questions in the chat. Lisa, the same platform work done by Unity. Are you talking about Unity, Unite Us? Is that
Unite RI? Probably Unite RI.
I can't talk about who the vendor is, but whoever the vendor is that we choose, we'll make sure that things are aligned. It's a purchasing rule. I can't talk about who the state has chosen. And then the clinical community providers, there is funding for this through the accountable entities. So all of the accountable entity providers will have access to the community referral platform. I don't want to say all and be wrong about that, but there are, I know that in the contract that we are negotiating, there's a sort of a step pattern, and they'll be able to do X number of connections in the first year and the second year. So give us the week that we need to get this done, and then we'll have a clear, be able to talk clearly about who will have access. But it is the first round of payment for this procured vendor is happening through the accountable entities and the Health System Transformation Project. And so it's focused first on accountable entities. Happy to answer any other questions.
Other questions from folks? Yes, Janet.
Marty, I really appreciate you offering to send information to our listserv, our email, and anything else. If there's public comment that we really would love to start getting our emails rich, related to behavioral health. Thank you.
So I will get you the sign up for the work groups and the information on the public comment on the behavioral health system review.
Thank you.
Okay, others, John, did you have a question? Is that on a different topic?
No, mine's on a different topic, Rich. Thank you.
the draft Faulkner HMA report that's coming out, that's going to get some level of written and maybe public comment on it. What is the department's timeframe for using that information and issuing a final report? How many months out is the plan? Is that towards the fall, towards the late summer, next week?
Probably late summer. The grant ends September 29th, so it's got to be before then. It won't be too long. I mean, I have a feeling it's a pretty in-depth report. I have a feeling you obviously folks will have comments and we'll take them absolutely, but I hope that you'll be pleased by the depth of the report and that you'll be, it'll be about implementing it.
Yeah, it's always the thing, execution, right? Yeah, thank you. Other comments? Marty, thank you so much. Very thorough, very comprehensive. We appreciate it. And we look forward to getting the updates on some of these public forum opportunities. Next is DCYF. I have Susan Lindberg listed. I don't know if she's here, but we'd welcome you to chime in with any updates from DCYF or Chris Stranad. Nobody? Okay, we will pass then on DCYF. Then we have Michelle from the Office of Healthy Aging. Michelle, are you on? Okay. Nothing there. So is there any other old or new business that committee members would like to chime in on? And John, I think you highlighted that you wanted to talk about a topic.
Yes, please.
Go ahead, it's yours.
I want to bring some awareness to the board, what's pertaining to problem gambling in Rhode Island. We've gotten a number of calls. Well, let me go back a little bit. Those of you that don't know, I am the chairman of the board for the Rhode Island Council on Problem Gambling, which includes the state police, the AG's office, and a bunch of other individuals. So we've been getting an overwhelming calls here and through 211 pertaining to problem gambling. And what has happened is that this app that the legislature put forth, where people can go and get the app up at Twin River and Tiverton, has now made its way into high schools and colleges because they're 18-year-old kids. And we've been getting calls here from parents who are distraught over getting their Visa bills or American Express bills, and these kids are online gambling. Unfortunately, the state has not stepped up for prevention or education. And as of June 30th, we'll have $7 left in our account. And we do not do anything with the lot or IGT. Twin River gives an enormous amount of money for treatment, but nothing for prevention and education. So people at BHDDH, OHHS, this is an addiction. Please listen, this is an addiction. Many people don't think that gambling is an addiction. It's an addiction. And we have a lot of people in serious trouble financially. Matter of fact, the Judge Gibney and I sat down and we are going to put a gambling court in the courts, hopefully by September, to help people through this issue. But I want to thank Ryan for going to speak to the lot on our behalf to try to get us some funding. But again, as of June 30th, we'll have around $7 left in the account, and that'll be the end of prevention and education for issues with problem gambling. So I'm just putting that out there because there's about $800 million coming into the state. And all we're looking for is a budget of 125 to keep these people and getting them into high schools and colleges and talking to these kids and putting programs together. And, you know, it's really sad that I have to beg, and this is an addiction again. So if you hear me, my cell phone is 401-451-1305. You can call me, we can discuss it, we can put in for a grant, we can do anything. I'm begging that we continue this program because there's a lot of people in a lot of trouble over, especially with the pandemic, where people can get the app and just gamble on their phone, on their couch, on their chairs at home, and it's really sad. So thank you.
Yeah, great, John. Thanks.
And
Questions
John,
or
to your
comments?
point, I think with the prevention councils, I think much like we talk about parent education with substances, we need to be talking about parent education, because I don't think parents, being a parent of teenagers, I don't think parents see it as such an issue. I think they see it more akin to, like video games and things like that. And they don't really realize the true dangers and what can happen to them and their finances, to their kids' finances, and how this can lead to a bigger problem in the future. So I think it's something we should start addressing with, with the prevention councils as well.
We had an excellent presentation at the Prevention Advisory Committee by Nancy Murray. And I would recommend that, we have her come to this council meeting also. And then she's got great data. That's local data that I think would be very enlightening for folks. I hope she'll be on board the next time we have a meeting. I don't know if this is affecting her position, John.
Just to be clear, that's a separate organization from us.
Oh, okay.
She is treatment, and we are prevention and education here.
Oh, okay. But Nancy's presentation was all about what was going on in terms of use levels, especially among youth. So I'd recommend that we have her do a presentation for us.
Yeah, Nancy is funded through the lot.
Oh.
I'm funded by begging.
Oh, okay. We got it.
Okay. Well, with the CARES Act and the rescue plan, maybe there's some wiggle room in there in terms of how to, it's a granted short term, but we'll take short term for now versus nothing. So good feedback. Other questions on comments on that topic or other old or new business that people would like to introduce? Yes, Linda. You're on mute.
Can you hear me now?
Yeah.
Okay, I just have a question. I understand that these meetings are recorded. Do we have access to those recorded meetings?
I assume you do.
This is Tia at BHDDH, and the recordings are on the BHDDH website.
Okay.
So I think recently those recordings have taken the place of the minutes. Is that accurate, Tia?
Yes, yes.
Okay, so I just go to the website and I'll be able to access those recordings?
Yes.
Okay. Would it be under any particular?
Is Linda Riley still on the call? I don't want to give out misinformation. I can send an email with the direct links for everybody to follow up with.
Okay.
That'd be good.
That's
Yeah.
another question. I haven't been getting any emails from Buddha about the meetings. I just know they're the first, second Thursday of the month. So I don't know if I got off the list, but I haven't been receiving any.
I think Candace put the link in the chat box.
That'll lead you right to the minutes.
Yep, it's in the
Okay.
chat box. Thank you,
Thank
Candace.
you, Candace.
Tia, can you make sure that Linda is on the mailing list, the email list for these meetings?
Yep.
Maybe you are, Linda. Maybe it's an incorrect one. Did you change recently?
I'm on iCloud now. Maybe that's why, but it should
Yeah.
still get through.
Okay,
I'll put my email in the chat box.
Okay.
okay. Great. Thank you, Linda.
Thank you.
Other questions? Laurie, you have your hand raised. Is that old or new?
New.
Uh-huh.
Thank you so much, Rich. I have a question. So some time ago, maybe it was last fall, it was announced that this council was taking applications for new members to join. Mental Health Association is currently a member of the public, but we did submit the required materials that were asked of us. And I'm wondering when we might hear back about our application to officially join the council. As you know, we are a consumer advocacy organization, and I myself am a mental health consumer. And so I'm wondering if you all think it would be helpful to have that perspective on the council.
Yeah, that predates me. So usually, I know that historically it's individuals. There are a number of statutory positions like the Leadership Council and the Mental Health Advocate and the Child Advocate that are designated to be on the council. All the rest are public and they're individuals, not necessarily by virtue of a position.
Okay.
So it's not like there's a mental health association seat on the council, you know. So are you saying you're a member of the council? Is that correct?
No, we're not.
Oh, you're not. So, okay, so you submitted your name essentially.
For Mental Health Association, not me personally.
Okay, well, it would be you that would be appointed by the governor. I don't know if that's been submitted, to be honest with you.
Okay.
I could ask Ryan or just to find out where that's at. I think maybe names are still being captured. What we don't want to do is, submit names every month to the governor's office. They probably rule on this a couple of times a year, and so the timing is key. So Ryan, any updates?
Sure, yes. Part of it is part of what the fly in the ointment for new appointments to the governor's council has been is just a result of COVID. There was a desire, particularly when the two sort of lead with at the time after over 2020 wanting to as Director Power came to BHDDH, we wanted to try and get a new chair for the governor's council at that time, and we wanted to get the chair of the governor's council before we made any membership decisions. And because it's really hard to overstate just how, I'm sure it's familiar to everybody here, how COVID really did, particularly the timing was particularly bad too. It was right at the beginning of COVID. And it left a number of those issues unresolved, including some, desire to get some resolution between the boards and appointments process about who would be our legislative members serving on the council as well. So we're hoping that we can take the opportunity with the new governor coming in to restart that discussion and settle kind of the range of membership challenges we have right now, and including, as Rich indicated, some folks who are folks who are on or statutorily named to the council, but are perhaps attend a little bit less frequently. We want to kind of revitalize the membership from a holistic perspective, and I think exactly as Rich indicated, we kind of the way the process works, out of hundreds of boards and commissions, we don't get many bites at that apple process wise. So we kind of wanted to tie it up into a bow.
Okay. So it's still in the works. So because you haven't heard, Laurie, doesn't mean anything other than, this is moving a little more slowly than we had hoped.
Thank you.
Okay.
Thanks, Rich. Thanks, Ryan.
Other questions, other comments?
This is Linda Hurley. I would just like to make a comment just to let people know this is happening. As we're moving along with COVID, the population that Kodak Behavioral Health serves and other OTARI members serve is actually one of the highest transmitters of infectious disease and one of the lowest in follow through with preventative vaccination and such. And that's, this has all been documented. So we're really excited that the governor's office and the Department of Health we reached out to them, and they're going to come to each of the Kodak sites. The reason that I'm sharing that with you is there's a number of vendors. And if you have a population that is, as it's called, hesitant, and especially, historically hesitant for all types of this kind of prevention, it's very easy at this point, and they're happy to come out. They're shifting some of the structural criteria and to really get shots in the arms of the people. So we're really grateful And I'd just like that to be, actually to be on the minutes. And I also would suggest that if any other persons listening represent or advocate for populations that have access issues, that these are being overcome now. So reach right out and to the Department of Health or the governor's office, COVID department, and they're doing a great job.
Okay, thank you. That's great. I think Sandra, you wanted to say something?
I just wanted to, formally request that we have a presentation by Nancy Murray at maybe the next meeting, unless there's another presentation planned.
Okay, I think the next meeting, they were teeing up the needs assessment update.
Oh,
by
good.
the state, so I'm sure that's going to take more than a minute or two. So that may just take up. our
Yeah,
time.
well, maybe the one after that then.
Sure,
Thank
we'll-
you.
we'll- Yeah, you'll queue it up somewhere. Yeah.
Okay.
Okay, good. No other business then. I want to thank you very much for attending the Governor's Council. Our next meeting is June 10th. So that has all the earmarks of warmer weather. So I think we're slowly crawling into that space. So there's a lot that's going to happen between now and the 10th. A lot of work that has to happen. And so you're all admired for your enthusiasm, your dedication, and your service to the behavioral healthcare industry. So I want to thank you. Okay, appreciate it. And we'll hopefully get together again next month on June 10th. All right, I'll call the meeting adjourned. All right, bye, everybody.
Bye.
Nice job, Emeritus.
There it is.